aimed at unraveling the state's COVID-19 restrictions. The proposals all moved to the Senate for debate on Monday. Well, in just hours, New Orleans will join the state in Phase 3. Mayor LaToya Cantrell says it'll be a phased approach. In a first phase, 3.1, which starts tomorrow, restaurants can open with 75% capacity inside with proper social distancing and 100% capacity outside. New Orleans is now 6 months into the coronavirus pandemic, and Mayor Cantrell has often said her decisions about reopening the city for businesses are based on data. So here's the big question. What can be learned from the more than 500 New Orleans residents who've died from COVID-19? WDSU Investigates' Greg LaRose has obtained records that provide insight on the fatal toll the virus has taken on this city.
New Orleans was one of the nation's first hotspots for the coronavirus. A surge in hospitalizations and deaths led to a public mask mandate and a shutdown of all but essential businesses. The coroner has provided WDSU with a breakdown of all deaths attributed to COVID-19 in the city, and we've reviewed that data with an epidemiologist and a demographer.
It's a very different epidemic now than it was back in March, April.
Susan Hassig is an epidemiologist with Tulane University. She highlights the dramatic difference in COVID fatalities from the first 3 months of the pandemic to the past 3 months. Since mid-June, there have only been 37 deaths, or just 7% of the total. Hassig says doctors are now applying what they've learned about successfully treating COVID patients.
The other piece that we have to recognize is that people who are and recognize that they may be at risk of dying of this are also being very cautious. And I think their families are hopefully being equally cautious.
The data also show the inordinate number of black people who have died from the coronavirus in New Orleans. Keep in mind, the city's population is just under 60% black. The racial disparity is not as severe statewide, where the black population is 32%.
What that's really showing us is that the virus was never really interested in what race we were. It was always about your level of exposure, how often you were exposed to the virus.
Lamar Gardier with the data center also says the big drop-off in COVID deaths is remarkable. He credits local officials for holding their ground on health precautions.
So that's the thing that really jumps out, that when we do what medical professionals say, it actually is making a difference in terms of lives being saved or lives being lost in New Orleans.
The data center used the coroner's data to determine whether COVID-19 deaths are concentrated in New Orleans based on home addresses. By far, most people are dying in hospitals, and neighborhoods with nursing homes have seen the highest tolls. When nursing homes are factored out, the biggest impact has been in areas of the city with a higher proportion of black residents. But it doesn't mean people are more likely to die from COVID-19 if they live in these neighborhoods.
It's been more of a demographic concern than a geographic one.
Looking to the future, Susan Hassig, the Tulane epidemiologist, says who gets the virus will play a big role in the death toll from COVID-19. For example, college students who live away from home and who can self-isolate if they test positive pose a low risk. But if they go home to mom, dad, grandparents, that elevates the risk and the likelihood of a tragic outcome. For WDSU Investigates, I'm Greg LaRose.
And you can read much more right now about how COVID-19 has impacted New Orleans at WDSU.com and, of course, on our mobile app. Still to come, say it's not so. Which players from the black and gold may not hit the field come Sunday?
And it's certainly